Okay, when we talk about the palpation of the exam in the knee, it's nice to have a little sense of the surface anatomy. So I'm going to try to make some drawings of where some of these areas are that we're palpating. I'll go ahead and start by identifying the patella, so everything else is sort of oriented from there. So the quad tendon's up here, and you can feel where you have the hard bone. So I'm going to go ahead and draw around the patella here, so we all have a good sense of where that is. Okay, and so obviously up here we have the quad tendon coming in and attaching to the patella. As we get down below the patella, at the inferior pole, there is a growth plate here. In kids that are younger than 12, generally speaking, the inferior pole, you can have growth plate injuries. And then we've got the patellar tendon, and that attaches on the tibial tuberosity right here, which is another growth plate that's usually open until the age of about 14, 15, in boys anyway, a couple years younger in girls. And this is where the proximal tibia is, and so this is where you're starting to feel the joint line. And so working now laterally and medially from the joint line, we can draw the edge of the proximal tib all the way out to where we find the head of the fibula here, and the tib-fib joint there, and then obviously feeling for the joint line all the way back. Keeping in mind that the fibular head, proximally, there is a growth plate here as well. It's going to be about a centimeter below, and with the tibia, same thing. So you'll have the epiphysis and about a centimeter below. Essentially where you've got the apophysis is also going to be the epiphysis. And then as we find the femur here, and that's going to give you your meniscus in this area, right in the joint line. And with the femur, probably about 1.5 to 2 centimeters up, in a developing, structurally or skeletally immature pediatric patient, you are going to have the growth plate underneath there as well. So now if we go lateral, remember the LCL is coming right off the fibular head here laterally and going to the femur. That's going to be your LCL. And then if we go medial, and that MCL is going to go from the distal femur to the tibia. And that's a thicker bundle, wider bundle. And putting the knee in external rotation will often, or the hip in external rotation will often bring out that LCL, so you'll feel that band right underneath where our drawing is here. And I think that concludes nicely surface anatomy for palpation at the knee. I am going to show those structures here on the model as well. You can see distal quad tendon coming in, the patellar tendon attaching here to the tibial tuberosity. This is not a pediatric model, but if you had one, you would have growth plate lines going across this way where the epiphysis is, and then here this is a right knee here, but the fibula would be superimposed on this side, and you'd have a sort of a proximal fibular physis there, and then you can see where the LCL is. So we'll just bring this knee up so that we are oriented properly. So you can see kneecap, patellar tendon attaching, LCL laterally there. Here's the LCL on this side, and then MCL here, and the thick double bundle MCL here, and in between you have the meniscus and the joint line. And of course, if you're looking underneath the kneecap, you can see your ACL, PCL there, and we didn't draw that because of the depth of it. So